want to become happier and healthier? Do you want to learn from a very, very prestigious doctor today? Well, I'm very blessed because on the first episode of the Cancer Conversations podcast, I have a very special guest who is the first UAE national breast surgeon. Now, we'll talk about all about breast cancer, how to prevent, detect, and cure cancer. If you don't know me yet, allow me to introduce myself. My name is Wanda Lintan Kalupig. I am the number one most influential Filipino on LinkedIn 2021. Also, top 15 LinkedIn expert in Dubai 2023. Now, I'm starting this Cancer Conversations podcast because after my mom, got this lung cancer, I realized there's so much need for people to be aware how to prevent, detect, and cure cancer because right now, globally, there are about 90 million plus cases of cancer that is, registered in 2020. And breast cancer is the number one cause of cancer for women. So today, we will talk on this first episode all about breast cancer because our purpose is, of course, to inspire story, to share knowledge from experts. And before I bring my guest on stage, let me introduce her. Dr. Houriya Kazim is a UAE national and the country's first lady surgeon. She attended medical school at the Royal College of Surgeons in Ireland and has a Master of Public Health from the University of Texas in Epidemiology and Disease Control. She obtained a double fellowship in general surgery from the Royal Colleges of Surgeons in England and Ireland before subspecializing in surgical oncology and breast surgery and reconstruction at the Royal Marsden Hospital in London. She worked as a volunteer in the Caribbean and a visiting breast fellow at MD Anderson Cancer Center in Houston before she returned to Dubai in 1998 to take up a post breast surgeon at private hospital. In 2006, she set up the Well Woman Clinic, a multidisciplinary clinic staffed by women for all women's health needs. In addition to her clinical work, she founded and runs a breast cancer support group and charity, Breast Friends. She is an adjunct clinical assistant professor at Mohammed bin Rashid University of Medicine and Health Sciences and is a freelancer writer on women's health issues. Now, without further ado, let me bring Dr. Houriya on stage. Doctor, thank you so much for saying
Hi,
yes.
Coach. How are you?
All good. Doctor, I'm very honored. You're my first guest for this Cancer Conversations podcast. I know your time is so precious. So let's start the ball rolling. My first question to you, you know, being the first UAE national lady to be a breast surgeon is something that's so prominent. And, I think it's one of a kind. I'll say I want to first honor you for that. Maybe can you share what inspired you to become that first UAE national lady surgeon?
First of all, thank you for having me on your podcast. It wasn't something where I had a goal in front of me that I was like, I want to be the first female surgeon for my country at all. And it actually, I come from a family of doctors, so that's the first thing. So it wasn't a surprise that I actually went into medicine. And my father was a surgeon as well, though an orthopedic surgeon, and it definitely wasn't something I wanted to do. My sort of heart is more into public health. I like the idea of taking care of communities rather than the individual. And so I actually went to medical school wanting to do public health, and I don't know why. Somehow I got sidetracked halfway through medical school. Somebody put a scalpel in my hand, and I was like, "Oh wow, I love this." And the thing is, because I look back now, I mean, we had no female surgeons in when I was training, zero in the whole country. I trained in Ireland, zero female surgeons at the time. And the surgeons that were there, which were men, were these old grumpy men. I mean, they would be throwing things at you in the operating room. And I look back now and think, did I really look at them and think, yeah, I want to be like that? So I don't think I did, but I somehow, after I sort of got the idea that I like this, I came back to
Mm,
Dubai to do my internship. And that's when I started seeing these advanced cases of breast cancer that I had
mm,
not seen during my training in Ireland. And I also saw that women were very modest. So I was an intern and the only female on the team. And they wouldn't let the consultant or even the ones just below consultant come in to examine the patient, but they'd let me examine them as the lowest on the rung of this ladder. And so I realized then a couple of things. So one is that they really need female surgeons here because we had no female
mm,
surgeons here either. And also that, women with breast cancer were presenting really late. I mean, it was appalling to me as a woman that, your breast is right under your nose. It's right there. You see it every day.
mm,
It's not like it's on your back or something or inside your body. It's right there. And that a woman would know something is wrong, and for
mm,
various reasons, whether it's modesty, whether it's just fear, would not do anything about it until it was too late. So those
mm,
were the sort of things that was in my head in terms of, the country needs female surgeons. I actually like it because I realized at the end of medical school, this is what I like, and the need in this particular field. So that's sort of how it happened. So it was really, and honestly, everything I've done career-wise has been that, recognizing a need and then seeing how can I fix that, or if I can fix that.
I love what you said, Doctor. Recognizing a need and finding
Yes,
how you can solve it. Now, I
yes,
know, Doctor, in terms of statistics, I did some research. They said there are about 19.2 million cancer that was detected in 2020. And breast cancer is the most common cancer globally with over 2.3
yeah.
million new cases. Now, Doctor, I know you've been doing this for like 18, 20 years. Maybe you can shed some light first in terms of detection. I know you rightly said, the breast is under our nose, but first, women are scared to even,
Yes.
recognize the pain and even see the doctor. Now, what do you think are the roles that genes play first in terms of developing cancer?
So there's quite a lot to unpack there. So first is first are the numbers. The numbers are scary.
I
If you look at women, for example, and cancer, just to put it into a more personal or individual point of view, 1 in 3 women will get cancer at some point in their life. It could be any cancer, not just breast. So some obviously get it as babies, some get it as children,
Mm,
and if you're lucky,
yeah.
get it in old age. So 1 in 3 women will get cancer. So that's pretty bad. And
Mm,
now, obviously, there are different types of cancers, and some cancers are what I call good cancers. People always ask me, is there such a thing? And there is
yeah.
such a thing. Breast cancer is actually one of them. And
Ah,
if you look at the statistics, you will see pretty much for most of the common cancers, they're all on the rise, all of them.
mm,
And
yeah.
the good news, because I always like to spin things from a positive point of view, the good
Love that.
news is that less people are dying from these cancers. So, what does
Ah,
that mean? It means we're
mm,
picking it up earlier, and it
mm,
means even more we are treating it better. We've become so good at treating cancer, even in my own sort of career from when I started to now. The way we treat cancer is so different compared to when I first started. So that's to put things in perspective. Yes, more people are getting cancer, but less people are dying from it. So it's becoming now more like a chronic disease. It's becoming like I've got
mm,
diabetes or I have hypertension. It's not that thing that when I was doing my internship that
yeah.
people presenting so late and people afraid because the fear comes if you present late with a cancer, if you leave a cancer till it's really advanced, then most likely
Mm,
you're going to die from that cancer. So then everybody else who's watching this now kind of equates cancer and death. But as
mm,
we have become better treating it as more and more people are living, having had cancer. Now it's not okay. We have it, but life goes on. The same way with other chronic illnesses. In terms of, you were asking like how to pick it up. So the classic sign of a breast cancer is a painless lump in the breast. So if somebody is usually that's how it presents. Now, people have said to me, well, I have pain. How come it's still a cancer? So it doesn't mean that if it has pain, it will not be a cancer. But that is the classic presentation, is a lump with no pain. The second most common thing that women will present with is a bloody nipple discharge. So blood coming from the nipple. Now, what we want, though, is we don't want you to feel that lump and we don't want you to have the nipple discharge. We want to pick it up before you pick it up. And that's where screening mammograms come in. So basically, a mammogram is an x-ray of the breast. And what we want to do is pick things up when it's in a pre-cancer stage, before it forms a lump, before it causes a nipple discharge. And that's a difficult thing in many respects, because when we talk about screening for anything, screening for colon cancer or doing pap smears for cervical cancer, the idea of actually being proactive, of actually not waiting until you have an issue to go and sort it out, but actually trying to sort it out before you have the issue. And that was a very difficult thing when I came back to Dubai. It's a bit like wearing seatbelts. You know, I grew up in the time where we didn't have to wear seatbelts. And now, of course, we don't think about it. I get in the car and you put it on like brushing your teeth in the morning. You don't actually think about it or negotiate with it. You just do it. It's getting better now compared to when I first came back, about women having screening mammograms. Now, the next step, what was the third thing that you asked on that?
Okay. Let me summarize first before I move to the next question. But I think I love what you said, that cancer is increasing, but the good news, less people are dying. So meaning really, that's good news that people are getting treated. And I think it's good that you share that, detecting through the mammogram is one of the best ways to get known, even before there's a lump or a blood in your nipple. Maybe this brings me to the next question, because you also mentioned there, science have progressed so much in terms of treating cancer. Can you share what really are the ways to treat, a lump in the breast, even before it becomes cancer,
Well, no. So, I mean, obviously, we have all kinds of lumps in the breast, and the majority of lumps we have are not cancer. So the first thing is that if somebody presents with a lump, obviously in their head, they're thinking, I've got cancer, I'm going to die. But 90% of lumps in the breast are not cancer. So the first thing is to actually show it to somebody. And that is the first thing a doctor will do, is they will do some imaging, mammograms if you're over 40, ultrasound scans, and then if necessary, a biopsy. So this is coming to the diagnosis. Then if it is not a cancer, if it's completely benign, then you don't have to have surgery. You can follow it up. There are other types of lumps in the breast. Not everything is either a benign lump or a cancer. We have many different types of tumors you get in the breast, and the management of those tumors will be according to whatever the biology is on the biopsy. So that's what we would do if somebody presents with a lump. As I said, what we try to do is try to find things before a patient finds it. So screening mammograms. So just to let people know what a screen is versus what a mammogram. If somebody presents to me with a lump, I'm doing a diagnostic mammogram. I want to know what that lump is. Screening mammograms, the same machine, but this is a woman who has no issues, and we don't feel anything in her breast, but we want to see that inside is also fine. And we usually start around the age of 40. Every country is different. Some do it every year, some do it every 2 years, some even every 3 years. For me, in my practice, I try to individualize it. So one is, what's the family history of this woman? So you were asking about genes. as part of the your question, the majority of breast cancers actually don't have a gene that we can find. Only 10% of cancers are caused by a genetic mutation. But if somebody has a genetic mutation, then I'm going to screen them more often than if they don't. Or even if they don't have a genetic mutation, but they have a strong family history, I will screen them more often. So there are various things that I look at to decide how often I need a patient to do screening mammograms. So remember, screening means you have nothing to feel and you have no symptoms. You just want to check regularly to see if, God forbid, something does come up.
Wow, that's very good. Then screening mammogram is one of the best ways for you to even, yeah. But
Exactly.
doctor, why only after 40 years old?
Yeah, so there are various reasons for that. One is the breast tissue tends to be dense when you're younger. If you remember your breast when you were a teenager, it's slightly different to what it looks like now. So when you're very young, the breast tissue is denser and you have less fat in the breast. And then as you get older, the breast tissue starts to regress and it gets replaced by fat. And when you become a granny, it's mostly fat. So when we radiate the breast with the mammograms, the radiation doesn't penetrate the dense breast tissue as well as tissue that's not. So that's one reason we don't give it very young, because obviously the reason for giving you radiation is we want to get some information at the end of that test, right? The other thing is that, you are going to have mammograms regularly for, most of your adult life. So the reason and it's still radiation, and the effects of radiation are cumulative. Radiation is actually one of the things that can cause cancer. So obviously we don't want to give you more than you need.
True.
So that's another reason why we decide. A third reason in some of these countries is that the government is paying for the screening mammograms. And so obviously they try to, they want to balance with screening their population with the cost of screening. So that's a lot of times why it becomes a 3-year screen instead of a 1-year screen.
I understand now. Now, doctor, also, maybe you can, I know there's a lot of mammograms. I mean, I know through reading and research and talking to a lot of people that cancer can be treated in 3 ways. You do surgery, chemotherapy, or radiation. Now, are there any other non-surgical treatments that's possible for breast cancer from your
We have a
experience?
lot, and this is what I was saying to you about how good we have become at treating breast cancer. It used to be really, I look back now and I think, oh my God, I can't believe we used to treat patients like that in a very non-scientific way. So we would say if a cancer was over 2 centimeters, it got chemo, and if it was under 2 centimeters, it didn't. We now know that the size of the tumor is irrelevant, because you can have a small but very aggressive tumor, and you can have a small, really kind of, lazy cancer. So size has nothing to do with it. Now we are really getting into the biology of the tumor. Is it feeding on hormones? Are there any other proteins on the surface of these cancer cells that we can target the same way that an antibiotic, for example, will target certain bacteria, for example? So we do that. So in addition to surgery, radiation, chemotherapy, and not everybody, so pretty much everybody gets surgery, not everybody gets radiation and chemo, but we also have, in addition to that, we have immunotherapy. So how to kind of modulate our immune system to attack cancer cells. And we have what we call targeted therapy. So some breast cancers have a protein on the surface, and we can literally make like an antibiotic to that. So it's like an antibiotic that attacks. Yeah. So if I just tell you, chemotherapy works generally, because we have many different types of chemotherapy, but generally chemotherapy works on cells that are dividing quickly, because that's what cancers do. But it doesn't know what's a cancer cell and what's not a cancer cell. So that's why your hair falls out, because in normal life, the cells that are dividing tend to be our hair. So your hair falls, but your eyeball doesn't, because your eyeball is not the cells are not growing every day, whereas your hair, those cells are. So the chemo kills any cells that are dividing, right? But this targeted
Mm.
therapy is really looking at these cells that have this protein on it, and this would be the cancer cells. And so we have specific treatment now that only kills those cells. So we have quite a lot of treatment in our arsenal now, and that's why every cancer is different and how we treat it is different, and that's why more people are living, to be honest. Yes, we are picking it up earlier by screening, but honestly the treatment and the way we treat cancers is really what's driving the survival rates from cancer. I think what we need now is to start looking at why are
Mm.
the cancer rates going up for almost all cancers. Why?
Exactly. That's the next question, Doctor, right? Why?
I don't
Like,
know. I'm gonna guess something to do with lifestyle,
mm,
environment. Where we know that there are lots of chemicals that we are in contact with that are hormone disruptors. We know that 2/3 of breast cancers are hormone sensitive. I don't think it's going to be something as easy as you ate this, therefore you got cancer, or you drank this, therefore you got cancer. But there's certainly, I think, for most things in this world, that it's a combination of your genetic
mm,
predisposition versus and some kind of carcinogen. So you mentioned, I'm sorry to hear about your mom and lung cancer. Many lung cancers are related to smoking, not all, but we all know people who have smoked their entire life and never got cancer. And then we know
mm,
people in their 40s who smoked a little bit who did get cancer. So same cigarette, same nicotine, which is a carcinogen, same carcinogen. Why are some people getting cancer who don't smoke that much, and then some people who smoke a huge amount don't get cancer? So there is going to be a kind of a combination of your own individual DNA and how it
mm.
responds to the carcinogens that we are in touch with every day.
I agree with you because really, doctor, when my mom was diagnosed with lung cancer, it's like, why? She never smoked.
She never
You know,
smoked.
she never. So, I mean, I think
That's
when I
the
was,
worst, because at least you can say, well, you smoked, therefore you got cancer.
yeah, I think at least I can say, because mom, you did this. And it's like,
No, bless
why?
her. Bless her.
The-
Yeah, no.
the-
So it's not all cancers are from, not all
mm,
lung cancers are from cigarette smoking, and not all cancers can we see a link to something very specific. So it's as I said, some are, for example, the 10% of breast cancers that are linked directly to a mutation in your genes, something that you've
mm,
inherited, it's in the family. But that's only 10% that we know so far. So,
exactly.
yeah. So I think that's where, now that we've become so good at treating it, I really think we start putting our resources into why. What have we done to our food sources, our water sources, our environment, the pollution? We know all kinds of things are related to disease. So I think that's what we should be looking at now. That's my public
I
health background.
I agree with you, doctor. While I was in the hospital, I mean, I spoke to a lot of patients, and I think every person has been through a lot. But I think it's both in all aspect, mentally,
Mhm.
physically, emotionally. I mean, I've met
Yes.
a person who got cancer, but she's very healthy. I mean, she's doing exercise, she's eating only
Yes.
healthy food. So it's like, why, right? But
Yeah. Yeah. Yeah.
it,
No, I have marathon runners who are getting
um,
breast cancer. So it's like, why? Why?
mm.
So it's very, it's a really tough thing.
Now, doctor, maybe I understand there's no one answer to the why, but maybe you can share what are the proactive steps for people to minimize the risk. I mean, let's talk about prevention now. How can you prevent getting cancer, breast cancer specifically? Or
So there's, I mean, when we look at risk factors, so
mm,
as I said, it's not generally one thing. You did this, therefore you got cancer. But we
yeah.
know that there are risk factors. We know that people who are overweight, for example, if you have a high BMI, you are more
Mm,
likely to get breast cancer than somebody who isn't. We know the genetic link in some people.
yeah.
And obviously there's nothing you can do about your genes. Well, a
Mm,
little that you can do about your genes. We know that people who don't exercise versus people who do exercise, so the ones who don't, have a higher incidence of breast cancer. We know other things that are more hormonal. So, for example, having your first period early and having your last period late. So, in other words, having more periods over your lifetime um,
oh,
is a risk factor. So, for example, Catholic nuns, because
mm,
they don't have any children, because normally when you have children, when you're pregnant and then
yeah.
lactating, you have a break from your period, but
Yeah.
nuns don't because they don't get married and have kids, and so they actually have a slightly increased risk compared
Oh.
to compared to people who have children. And then, so there's a lot of things like that. Alcohol, for example, is very
Mm,
strong to breast cancer and other cancers, not just, and other diseases, not just cancer, but definitely alcohol is linked to breast cancer. So there's some things that you can't do. Obviously, genetic mutations, you've inherited it, though there's a
mm,
lot being said about uh, epigenetics, which is okay, you have a genetic mutation, but
mm.
we know even in people who have inherited a mutation that is directly related to breast cancer, they don't necessarily get breast cancer in their lifetime. We know they have the gene, but they don't get it. So there is a lot of talk about, okay, I've inherited this. What are the things that I can do to actually make it less likely that that mutation expresses itself as a cancer? And that's where exercise, diet. So
Mm,
anti-breast cancer diet, if you like, is the anti-heart disease diet, which is the Mediterranean diet. So this
mm.
is basically a diet that's based on whole grains, fruit and vegetables, fish, and at least 2 tablespoons of olive oil a day. So
Oh.
that is the diet that we used to have in this region, for example, before all the fast foods came in. So diet, you can avoid alcohol, you can exercise,
Mm,
and the studies on exercise, it doesn't have to be like kickboxing and all these kind of like strenuous things. It's literally walking half an hour a day or an hour alternate days. It's very moderate exercise. So those are things that you can actually do, because one of the things that I've seen in my own practice, just for your listeners, if they are mostly from the Philippines, is when we look at the epidemiology of breast cancer. So we want to see around the world who has the most breast cancer. So the highest
mm.
incidence is in the West, North America, Western Europe, Australia. And when we look to see the lowest incidences of breast cancer, it's in the Far East. But amongst the Far East, the Philippines is one of the highest incidences of breast cancer. I don't know
Mm.
why that is. And so I don't know if that's a dietary thing, environmental thing, or what. But generally, Filipinos within the Far East have a high incidence of breast cancer.
Oh, that's sad to hear. But I think, what I found also, if you're overgiving, Filipino mothers are the most overgiving persons I've
In
met
terms of food,
in terms of everything.
everything, I know,
I
I
mean,
know.
they
But
will
I
take
think,
care of others, not themselves. So this is the culture. So I think it stems from that, but maybe both the environment, the food, I agree. We're not used to eating the Mediterranean diet.
yes, Exactly.
So
And I think even if you look at, okay, the other people in the Far East also don't eat a Mediterranean diet, but they do tend to eat, think of a Vietnamese diet, they do
yeah.
tend to eat more steamed things rather than, I notice the Filipinos eat a lot of fried foods.
Yeah,
And they
exactly.
also like, and they like a lot of junk food, you know?
Yeah, I
So I
know.
think, yeah, so I think all those things are difficult, you know?
I agree with you. A healthy body comes from a healthy diet, and I
That's
think
right. That's
our
right.
culture is somehow not in the healthy zone. Now, doctor, we're almost towards the end. I know a lot of people, I mean, being the first, UAE national lady surgeon, what is your advice? I know a lot of women want to be somebody. Now, if they want to follow your path to be, oncologist or to be a breast cancer surgeon, what is your best advice to these women who wants to change life like yours?
No, people who are already doctors who want to do this, or
Who like to be like you? Yeah, how to be like you, doctor?
I think, I don't know if it's, I mean, one of the things that's lovely is actually, for me, what I try to do now is go to schools and try to encourage girls into science, into medicine, and then the ones that are in medicine to see surgery as a viable option. Because for me, I know I didn't have anybody to look up to, and
Yeah.
even, and definitely nobody who looked like me, you know. And I think that's
Yeah.
so important because, as they say, if you
Mhm.
can't see it, you can't be it. So
Yeah.
it's one of the things that my medical school did is they have a picture of me outside the exam hall, and they've
Mm-hmm.
said that I've have some of the students say to me that they'll stand there waiting to get into the exam hall and they look at my picture and they'll go, you know what, if she can do it, I can do it. And I think that's so important. And the other thing is, as I said before, it wasn't about, I want to be the first this or I want to do that. It was literally about following what I was enjoying, what I had a passion
Mm-hmm.
for, what I was good
Mm-hmm.
at, and then seeing that there was a need for something and then following that route.
Oh, this is your ikigai, Dr. Houriya,
Yes,
because this is what you're
exactly.
in.
Exactly. That's exactly what it is. And I did it
Yeah,
without even knowing it had a name.
I know, right? I think the good thing you fell into it at the right. I mean, a lot of people are struggling, but I think you rightly said, it's good to meet and see people like you who are living their ikigai because you're loving what you're doing, you're passionate about it. It's not something that you plan. It's something that's, a journey, right, that you've been into. Now,
Yeah.
I know there's women clinic in Dubai. How can people, if they want to get a checkup, if they want to visit your clinic, maybe you can share all the contact information about you and your clinic, and what are the services that your company is offering?
Yeah. So the clinic we have, so I'm a cancer surgeon. So I usually just see either cancer patients or those who are at high risk of cancer.
Mhm.
I have in my clinic another surgeon who sees low risk patients, and we also have two screeners. So these are doctors who will screen you not just for breast cancer, but for a host of women related illnesses.
Oh, that's good. So, doctor, we will of course give all your website information, contact information of Well Women Clinic. I know you also have something called Breast Friends. Can you talk more about that?
Yes. So Breast Friends is when I first came back, and obviously I was starting my practice, I was working as a surgeon, but I felt that the women could use support,
Hmm.
psychological support, but not necessarily from a psychologist. I mean, as women, we like to uh, we like to talk our problems out, right? This is how
Yes.
we deal with things. When something's
Yeah.
bothering us, we call up our best friend and we have a long conversation about it. And so I felt there was a need for this, but again, it was a difficult thing to approach here because um, especially the local women, it's not part of our culture to talk about things that are
Mm.
very serious like that. So women would have cancer and be going through treatment, and only the people in her house, her husband, sometimes
Yeah.
not their mother, sometimes not their kids, know that they're
Mm.
actually having treatment. So, but that doesn't mean they didn't need to talk about it. So I started initially just putting patients one-on-one together, just people, I would match them sort of for age or language spoken, that kind of thing, where I felt that they would benefit from each other. And then we tried to start a support group, and that took a little while because, again, everybody thought it was going to be like an Oprah Winfrey thing where everybody would sit and just, talk about their deepest, darkest secrets. And that's not what the women wanted. They wanted to be
Mm.
able to come and meet other women so they could drop their
Yeah.
guard and just be themselves, and then have some kind of educational talk. Sometimes we
Mm.
do fun things, we do dance classes, we do art classes. And so the meetings that we've run now, we just celebrated our 19th year
Wow.
of the support group. And the group has kind of merged into sort of a 3-part group. So we have the first part of the meeting for those who really do want to have a little bit more information, but also an exchange of their feelings. That part of the meeting is run by a psychologist and a life coach. And then the
Mm.
second part we would have is something that is more educational, a lecture, a talk, sometimes on something related to cancer, but sometimes not. We'll have people who come in and talk about complementary medicine and other therapies that are available in the community. And then we also have a kind of an informal mingling and, having tea and biscuits and things. And that's sort of an informal way of sharing with other women who have had a similar experience. So that's been going on now for 19 years. So we're in our 20th year, actually. And then we also, as part of that, what we try to do is raise money, or have companies in the region raise money that help women pay for their cancer treatment.
Wow, that's really something. Now, doctor, if people want to work with you on the charity, be a member, if they want to support, the cost of the people who needs help in terms of funding, how can they do that? Can you
So
share?
I can share with you the our website,
Okay,
and yeah.
okay, we will share everything on the website. So today, doctor, maybe any last words before we end this interview? I've learned so much in terms of, you said 1 in 3 women, are prone to having cancer. But the good news is that it's getting treated. Less
It
people are
is.
dying. So
Exactly.
the best way is to do these screening mammograms to prevent, and of course, seek doctors who are experts. And I think what I've learned today is that there's really no direct reason of why you will have it or why you're having it, but the
Exactly.
best the best thing is to take care of yourself in all aspect, and I think maybe some last few words before we end the interview.
Yeah, I think, it's important that we recognize that we are important as women, that we are mothers and sisters and daughters, and a lot of people depend on us. And so it is our job to take care of ourselves. We're always so busy taking care of everybody else. You yourself said that, mothers,
Mm.
Filipino mothers are the most giving. I think all mothers are. And I think we, at unfortunately, thinking about everybody else and then ourselves suffer. So one
Mm.
is being proactive about your health. So not waiting until you feel a lump, not waiting until something feels different. Once a year, having a full check, your blood pressure, your sugar, a pap smear, your breast. And then if, God forbid, you do find something that looks or feels or something is not right, then don't sit on it. Go see somebody. It may be that it's fine, but at least, or it may not be fine, but at least you're picking it up early.
Hmm. So, doctor, thank you, thank you. I think I agree with you. I think mothers, we play a lot of role. Women specifically, you're right. You are, you're a mother, a daughter, a sister, and
Yeah,
then a wife, and then a
yeah,
friend. It was like, which one, right? And then you forgot to take care of yourself. I mean, I've learned it the hard way. But thankfully, after surviving burnout, I've learned how to pause, how to stop, how to seek help. And I
yeah,
think I want to encourage those women, if you are feeling, I think our body will always have a message if something is wrong. And
yeah,
I think it's good to know that there are doctors now, like I mean, I think the biggest fear also is there's something that you feel in your breast and you're going to see a man who's a doctor, right? But if you know it's a woman, then you already feel safe
yeah,
in that space, right? So it's good to
exactly.
know that you, Dr. Houriya, you've been doing this for some time. And I think I can feel how much this work is so meaningful to you. And I think I want also to inspire other women that, if you want to become like Dr. Houriya, I mean, she's living a testament of what's possible, right? As you rightly said, Doctor, if you can do it, others can do it.
Exactly.
So I hope you continue to be an inspiration to many women to follow their path, to take care of themselves. And I hope forward to seeing you again soon, and I hope to meet you really.
You look forward to it.
Thank you very much. I will drop all the social media links and also
Okay.
the Well Women Clinic, the Breast
And the
Friends, and
best
of course
friends.
their
Yeah.
social.
All right.
Thank you.
Thank you. See you.
God bless you. Thank you, Doctor.
Thank you.
Thank you for watching Cancer Conversations with Coach Wanda. This is episode 1. On episode 1, let me summarize what Dr. Houriya Kazim, the first UAE National Lady Breast Surgeon, explained to us all about breast cancer. If you want to prevent breast cancer, the good news is that you can do it through a healthy lifestyle. So make sure that you exercise, eat the right food, and avoid alcohol. She also explained in terms of detection, if you want to detect breast cancer ahead, it's stop waiting for the lump, to come out or the blood in your nipple to come out. Get yourself screened through screening mammograms, and you have to do it specifically if you're age 40 and above. In terms of curing cancer, she shared that there are many ways to heal cancer now. I mean, breast cancer, there are many cases of people having it, but the good news, the survival rates are increasing, and you can get cured through radiation therapy, immunotherapy, targeted therapy, and surgery. So get yourself checked, get yourself the right doctor. If you want to get more information about Dr. Houriya Kazim, she's based here in Dubai. She have the Well Woman Clinic, and she also have something called Breast Friends. Breast Friends is a support for women who have breast cancer. All the information, check the link below and we will share it. And of course, I would like to thank you for watching us live or on replay. I hope today you get to learn a lot about how to prevent, detect, and cure breast cancer. Again, this Cancer Conversations podcast is something that I started because after being diagnosed, my mother has lung cancer. And after being diagnosed, I learned that there's so much lack of information in terms of cancer, and there needs to be awareness in terms of what could be done to prevent, detect, and cure it. So, if you're a company, consultant, or coach in the business of preventing, treating, supporting cancer patients and their caregivers, I would like to invite you to be our next guest. Please go to bit-ly podcast partner form. Fill up the form and we would love to have you on our upcoming episode. So thank you for watching us live or on replay. And also, I want to thank Katan Social Media Marketing for producing this podcast. Katan Social Media Marketing. We are a team of LinkedIn podcast experts. We stream our live podcast on LinkedIn, Facebook, Instagram, and YouTube because our goal is to get seen, get heard, and get your message out there so the right people can come and find you. If you want to know more how Katan Social Media Marketing can help you Get seen, get heard, get clients. We tailor fit CMO services for you and your business needs. So send us a message. My team and I would love to help you. If you don't know me yet, allow me to introduce myself. My name is Wandalin Tan Kaluping. I am the 2021 number one most influential Filipina on LinkedIn and a top 15 leading expert in Dubai. I use my experience and expertise. By profession, I'm a certified public accountant and audit manager, but I know the world needs a lot of information right now about cancer. So I'm starting this Cancer Conversations podcast to share insightful information and inspiring stories from healers, healthcare experts, cancer patients, caregivers, and survivors to shed light, give information, give support because I know a lot of people need help, and I hope this podcast called Cancer Conversations with Coach Wanda help you today. If you want more information, watch the video because we will share more in terms of what are the upcoming episodes that we have. And also, if you want to know more about content social media marketing, watch these videos. See you on the next episode. God bless you.